Hello, my name is Beverly Blankenship, and I am with different companies in the healthcare industry. And one of the companies that I'm with is Free National RX Discount Card. And what this means that you can present this card with your prescription and save up to 75% on your prescription drugs at over 80% of the pharmacies across the nation. And on the back of this card, you can actually save 50% on your MRIs and CAT scans by going to that website. And I just got an email today saying that LabCorp, our lab company, they're negotiating new prices. So right now we're not presenting the lab part of it, but when it's back online, then you can actually save big dollars on your lab work by just paying for it online and printing a requisition and going to LabCorp and getting your blood work done. And this card also, for your pets, you can save up to 75% on their medications. You just get your veterinarian to write you a prescription, and you go to Walmart or Rite Aid, whatever, and do the same for them. And the one that is new to me, I'm just been promoted to a marketing director with Independent Association of Businesses, IAB. IAB, you probably haven't heard of unless you're in the insurance industry. Is kind of new to this area because I'm a representative, and I've brought on other people now, so Stockton's going to be hearing about us. So, and with IAB, it's kind of like AARP. It's an association. You become a member of the association, which allows you access to their medical indemnity plans, along with life insurance, and along with Aetna Dental is also included in your plan each month. And so IAB is a 30-year-old company. It was founded by James Wood to help support small businesses, to lobby for them in Washington, D.C. They have an office on Pennsylvania Avenue, just right down from the White House, a few blocks, and they do a lot of lobbying for small business owners. And also they have a office and a servicing center in Dallas, Texas. And they elect their board of directors. So it's not a 1 and 2 person owned company per se. And on the back of this sheet, across the top are the different programs, and down the side are all the components of each program. You can have membership without being worried about pre-existing conditions. Pre-existing conditions will not deny you insurance. And so it depends on your budget. This is budget driven. So what does your budget allow each month for medical insurance? It's limited, which means we're so used to paying a copay, right? A monthly premium, a copay, or a deductible, for the hospital. With this, you go to the doctor, and it depends on what your plan allows for your doctor visit. An individual gets 5 visits per year, and a family gets 10, which means that if your office visit allows 50 or 75, when you go to the doctor, and I've already used mine, you take your medical card that you get and the letter that goes with you to tell the doctor exactly how to file your claim online. You don't pay the copay at a primary doctor. They will reprice. They file the claim to a third-party administrator of the network, and you get the wholesale pricing. Wholesale pricing means what the insurance companies pay. So, and against that wholesale price, you actually have the $50 or the $75 applied against that. And then you get an eligibility, a benefit statement, just like you do with Kaiser or Blue Cross or whomever you may have right now. And if there's a balance left, that's what you, as a member, pays. You do the same thing right now. And so with the hospital, you go to the hospital, the bill is filed with the third-party administrator of the PPO network. It's repriced to the wholesale pricing. Then, depending on your plan, whether it's the select plan here is $125 a month for a reason. You don't get as many benefits. But if you have that and you went to the hospital, your bill is repriced at the wholesale level, then the $30 a day is applied against that. So if you can't start anywhere but that one, that's better than nothing when it comes to insurance. I mean, there's something. But the next one is $500 and $1,000. So after your wholesale pricing, you get the $500 or $1,000 applied. One event in the hospital, except with the Select, is a 30-day event. It's event driven. So after you use up your 30 days on one event, you have to go back to the hospital. It starts all over again for a 30-day event. The Select plan is 180 days. You can be up in the hospital for 180 days and get that $30 applied against it. So that's how that works in just a short way. And you get $5,000 of life insurance in this program. You get Aetna Dental, it caps out at $1,000. And you know, Aetna is better than nothing, but Aetna is not one of my favorite. We've had it with, you know, before I ever got into this program. And so as a basic membership with IAB, you get the legal, you get tax consultation, which means you can have your taxes done free. You get identity theft, which is through LifeLock. Stan McVeigh is not here, so I can say, you know, it's better than nothing, okay? And by the way, I have his also. Oral medical assistance means that, you know, if you are traveling abroad and something goes wrong medically for you, that company, which we have contracted with, will help support you in getting you back home, taking care of you while you're there, the whole bit. Also, Centerport Technologies is a company that if you need to be LLC, you can use that company to become an LLC business. And does everyone know what that is? Yeah. So anyway, you have that access just as a basic membership. And then you have something they call medical tourism. Anyone familiar with medical tourism?
Yeah, I've heard about it.
Okay, if instead, you know, with the limited insurance, if you don't want to go in and pay $150,000 for a hip replacement or a shoulder replacement or whatever, you can choose to go to a hospital abroad. The doctors have been trained here in the United States. Those surgeries abroad in these hospitals, between $8,000 and $12,000 by surgeons who trained here in the United States. And we just found out that they're getting their first hospital, medical tourism is, in San Diego, California. And they're going to be coming out with that information. My time is up? Okay.
No.
Hey, you ended on time. But anyway, on the back of this is more information. My website is on there. My phone number is on there. And feel free to call me. And so, you know, for $125 a month, people can have benefits.